Quick motor insurance quote. We all need medical assistance at certain occasion in our lives, and we additionally need the confidence of knowing that our children will be cared for should they fall sick or suffer an accident. In developing nations, a lot of people wrestle to buy the drug treatments and medicines they need and have to rely on charity. There is a campaign in the West to influence pharmaceutical firms to make their products accessible at prices folks can pay in poverty-stricken communities. Sometimes these firms will only put the high-cost branded medicines on the market. They have also been known to flood the marketplace with past their sell date products. Inexpensive healthcare is out of reach for a lot of people. It can also be complex for industrial nations, especially when somebody has a long-term illness. On the whole, people need to have some sort of private health insurance to meet their needs. The difficulty is that a lot of families prioritize their funds to be spent on rent and food, leaving a small amount left for anything else. Inexpensive healthcare frequently comes at the expense of something else. In general, the population is living longer. This is putting enormous strain on every country's health organization. There are more people living into their 80s and 90s, and they have several medical problems. At the same time, middle-aged people are falling victim to heart disease and strokes. The debate rages as to whether the state ought to give health care or if it should be left to the duty of the individual. It might work better as a combination of the two. The UK is fortunate in having a welfare state. Medical care is free at source. There are exceptions to this involving dental and ophthalmic costs. There is also a normal charge for prescriptions. This welfare system has to be paid for through direct and indirect tax. Americans don't enjoy a welfare state, but they pay less tax on petrol, etc. Reasonably priced healthcare is swings and roundabouts. Private healthcare is available in the UK as well for those who wish to pay for it. This means you get treatment a lot faster and can be admitted to a private infirmary on a selected date for operations. The split between private and state provision creates a lot of argument, with some people believing that no one ought to be able to jump the queue because they can pay to do so. Private patients additionally take medical professionals away from National Health Service patients. Everybody is agreed that inexpensive health care for each and everyone is a desirable goal, but no one seems sure on how to go about it.